psychosocial issues. Now, the brain and the central nervous system in large part control activation of the immune system. And I love that there's research on this. This is something that we've been hypothesizing on for a while, but I did find some more recent research on it. If you guys are interested, let us know. I'll somehow get that link to you. So now when the central nervous system is irritated on the physical plane, we can get chronic inflammation. So I'm talking about the vagus nerve or cranial cervical instability, like Dr. Gordon was just talking about. And now when the nervous system is in a constant state of stress or fear or self-protection, the nervous system is on edge, and that keeps the immune system dysregulated. So a lot of you might even be thinking, yes, that's me. When I feel stress, and I sure feel a lot of it now, I can feel a lot of my patients say a buzzing in my body, or a weakness in my body. It shows up differently in different people, but you might notice that stress response, and maybe you get flares in your symptoms when you get that. So stress makes illnesses worse. We're not sure about if it causes illnesses. I think it could be a contributor, but we do know that it definitely amplifies what's there. And of course, there's been the global trauma of the pandemic, and we're seeing a lot more of this now. Moods are a part of this. OCD, anxiety, depression, typically due to inflammation crossing the blood-brain barrier. We can do tests for this as well. So the moods, they're real, but they didn't cause the illness. They're just a product of inflammation, inflammatory chemicals. A lot of our patients are told, you're just moody, you're just depressed. I'm sure you are moody and depressed as a result of inflammation that these toxins and infections are creating.
It's very hard to predict who is going to get well and who isn't, because it really depends on the level of, your will, the doctors that you find, the support that you have. But the most important thing is again, the will to keep trying, because there are answers out there. I have seen so many people. I've seen people who've been trying for years and years, and we get lucky with, and they get better. And I've also had patients who I've tried with and don't work, and they go somewhere else and they get better. So my thing is hope. There is always, when you have a chronic illness, that's the difference. You have an acute illness, you might die. Chronic illness, yes, over 30, 40 years maybe, but generally this is your immune system stuck in a loop. And if you can find the pattern that will unstick your immune system, you will often recover. And it's just amazing how resilient the body is. Okay, so and hope is our most, hope and intention, is just the most powerful tool. So I love the science, and we're going to keep looking and hunting for all the answers we can find, but it's in you as well, that real desire to find the way back to, living a life unencumbered by your body. Your body is serving you instead of limiting you.
Right. And we see it every day. It's common for our patients to get better. You go on a journey with us. Actually, the way I practice is very much that way. It's absolutely a health journey. I'm your partner along the way. And I monitor you. I watch you like a hawk, actually, tailoring your treatment plans, because as you're being treated, you're changing from moment to moment. You're changing. And so therefore I need to follow you and guide you at the same time, and shapeshift what we're doing for you to match the trajectory where I want to take you. So it's a partnership and a journey together.